Welcome to the AATS Mitral Conclave 2017. I'm pleased to be joined by Don Bobo. Don, we, on behalf of the AATS and David Adams and the Mitral Conclave, we really want to thank Edwards for your incredible sponsorship of this program. You all have been a leader in education. Tell me a little bit about Edwards' philosophy for education with fine meetings like this.
Well, Randy, first of all, thanks for this opportunity. And education is, in our view, very, very important to this field. As you know, the mitral valve is a significant disease burden for patients. It's a complex disease, and to think we're going to go in and address those issues without partnership with physicians and extensive education, we just don't think it works that way. So we're thrilled to be here. We're pleased with how this meeting has developed over the years, and we think the next 10 years is the decade of the mitral valve.
It's fabulous. Don, you all, as other corporations who are in the valve space, have made tremendous advances in sort of the technology. Do you have engineers that come and benefit? Some of your top engineers I think I've seen in the audience.
We do. Actually, these meetings are some of the best places to get engineers and clinicians face to face. Instead of sitting in the audience listening to everybody else, we pull them together face to face. They look at devices, they talk about early results, they talk about imaging and guidance, and they come back with a treasure trove of insight that goes into the next set of developments that we put together. And it's an important link in the innovation cycle. Couldn't do without it.
It really is. Obviously, Edwards was a tremendous leader in the TAVR space, which has, I would have never predicted the size and the scope. Maybe you guys did.
No, it's exceeded our expectations.
Well, just the way that just the technological advances. Tell me how how do you all view what's going to happen in the next 10 years in the mitral space, and even tricuspid?
Sure. Well, we think tricuspid is going to be very important as well. And one of the things we learned in the TAVR journey is that when you're able to touch patients with these catheter-based technologies, the early enthusiasm gets anchored by improving clinical results. So the ability for, in TAVR, the SAPIEN 3 to deliver 30-day results of 1% mortality, 1% stroke, really enables physicians to use it for a broader group of patients.
Right.
We believe for mitral and tricuspid, that same opportunity exists. Between procedural developments and technology, we can allow patients to get treated and make sure that the cure doesn't cause a bunch of other problems.
Right.
That's going to drive interest, that's going to do a remarkable thing for patients, and it's going to enable the kind of growth that we've seen in TAVR. It'll take time. This doesn't happen overnight, but we really believe the same opportunities in front of us for mitral and tricuspid.
Don, the Edwards, like other of your collegial companies, have been leaders in actual surgical valves. Is this a difficult thing right now with, since everybody says, well, gee, what's going to happen to the surgical valve space, but you're still doing innovation in that space?
We are. We've been fortunate to have significant innovations roll out in the surgical valve space, a brand new tissue platform that we think is going to be great for young patients, a valve design that as it ages and if it wears out, you can do a TAVR and get the same hemodynamics. We think that's going to be powerful, and that rolls out in the next year. And the other thing we've learned is all of the investments and learnings in surgery are tremendously informing for the kinds of things we have to do in catheter-based valves.
Right.
So while they seem competitive, there's actually more that complements than competes. And I think physicians have experienced a growth in the overall market, which we think is great for patients, and surgeons tell me now they're busier than ever.
That's super. Final question. Here we are in New York, in the United States, and obviously you all are very active in North America and in Europe, but you have a global look. Is it difficult to manage sort of the future when you have underdeveloped countries and you have rheumatic fever in Asia and South America and places?
There are definitely patient groups and diseases that are hard to access just because of the economics. But one of the things we've learned is that if you come up with a piece of innovation that's patient-centric, it's actually a great uniter. It brings people from all over the globe together, very interested in, if you can take my patient to a better place with this therapy, then we're interested. And we find that fuels a lot of interest across the globe, and it's something that, again, we think is a very important part of us understanding what can have an impact on this disease. So I think the international community is a very important partner for us as we take this journey.
Super. Listen, on behalf of David Adams and the Mitral Conclave and the AATS, again, thank you and thank Edwards for all you've done over the years, and we really appreciate it. Thanks
Randy,
very much.
thank you.
Okay, Don.
My pleasure.
And thank you all for watching. Come back and join us soon.